Welcome, everyone. Good morning, and thank you for joining us today in the California Quality Collaborative. Today's webinar is COVID-19 Sharing and Learning Telehealth for IPAs. Just want to remind you that this webinar is being recorded. We will be sharing the slides, the link to the recording, and any other follow-up resources that come up from today's webinar. We will send them 1 or 2 days after today's session is done. Before we get started, I would like to remind you of a few technology tips. Attendees are muted upon entry. Please, if you have dialed in, please refrain from using the hold button, so we don't want to hear your background music. Please use the chat box if you have any questions to participate. And also, if you have any technical issues, please direct message me and I will help you as best as I can. At the bottom, you can actually also see the toolbar where you can click to join your audio. You can turn off your video and then also see the participant list and the chat box. To join, to unmute yourself, if you have joined through the computer audio, here there is a little microphone icon in the toolbar at the bottom where you can click and unclick and click again to mute or unmute yourself. If you have dialed in, please remember to press *6 in your phone, and that way you will mute or unmute yourself. We're gonna have a lot of participation coming up in this webinar, and we definitely encourage you to speak when there are opportunities. Zoom right now is experiencing a lot of overload, and so we want to encourage you at the moment to please do not use the video feature, as it can create problems with bandwidth. And then also, we might have a little bit of problems with the polls, but we will do our best as I can. So when we have polls coming up, there's going to be a pop-up window where there's going to be the question. You can click your answer, and sometimes you might click multiple answers, and make sure that every time you do it, always click submit. So at this moment, as we're getting started, I would like for everyone to please chat your name and also the organization that you belong to. Great to see everyone. Thank you so much for joining today's webinar. So at this moment, I would like to get also started with a poll. So as you can see in our screen right now, there's 2 questions that you will be answering soon. I'm going to launch the poll right now. Everyone see the poll right now? Great. Okay, a couple more seconds. Make sure to click that submit button so your answers are recorded. Okay, and we're gonna end the poll right now. And we would like to share the results. Can everyone see the results? Great. So we see a lot of people from the greater Los Angeles area. which is great. Welcome everyone from Southern California and also some people from the Bay Area local. So thank you everyone for joining. And in regards to different types of organizations that we have a lot of IPAs, which is great. We definitely want to hear from you and anyone else as well too, providers, health plans, any other organizations, nonprofit. So at this moment, I would like to move on, and I would like to hand everything to Chris. Chris, this is you next.
Hi, good morning, everyone. Next slide, please, Jose. For those of you who don't know me, I'm Chris Yeager. I'm the Vice President of Care Redesign at California Quality Collaborative. I joined the organization about 2 months ago, and I'm very excited to be here. I'm a hospitalist by background and practiced an independent group in San Francisco for about a decade before moving into executive positions in informatics and value-based care, both on the provider and the plan side. As you know, CQC is a healthcare improvement organization dedicated to advancing quality and efficiency of the healthcare system in California. And our role today is one of convener and a facilitator for the identification of best practices related to telehealth and the IPAs. While we might not be an absolute subject matter expert on this topic or others, we certainly commit to following up if we don't have answers with you. Next slide, Jose, please. Okay, so I'd like to introduce Chris Peron, Director of Improving Access at the California Healthcare Foundation. We learned yesterday of a new source of funding to potentially help practices with adoption of telehealth. Chris?
Great, thanks Chris, and thanks for this opportunity to share this great opportunity. As many of you know, HealthNet, under the terms of the California Department of Managed Healthcare's approval of the Centene acquisition of HealthNet, agreed to set aside $65 million to improve enrollee healthcare outcomes. And as part of that, over a 5-year period. And just this past week, within the last few days, HealthNet and the Department of Healthcare, Managed Healthcare Director, Shelley Riard, agreed that they would dedicate $6 million of that, or $5.9 million of that $65 million to addressing COVID through the use of telehealth, and specifically to enable the expansion of telehealth capacity and capability among safety net providers, including federally qualified health centers, other safety net clinics, including rural health centers, Indian health centers, 330 lookalikes, IPAs that have 30% or more of the Medicaid population or that serve in health professional shortage areas. And for all of them to be eligible, it's only those that operate in non-county organized health systems. And this reflects the service area, the service opportunity for HealthNet and Centene. I understand there's a link to the application on the CQC website, and I'm not, as Chris said, I'm from the California Healthcare Foundation. I serve on the advisory group for this, what's called an undertaking for the $65 million investment. So I come to you in that capacity. Questions and information and more information should be directed to the HealthNet team.
Great, thank you so much, Chris. And CQC is available to help organizations to complete their grant applications if need be. Please just reach out to us through the CQC info at Cal Quality. Well, that's the website. Just reach out to us through the chat if you have an interest, and we'll connect with you. Thanks. Next slide, please, Jose. So at the end of today's webinar, we should collectively have a high-level understanding of the rapidly changing guidance related to the use of telehealth during this crisis. We should all have surfaced challenges and executed potential solutions for IPAs regarding the use of telehealth in small and independent practices, and identified resources and opportunities to promote the use of telehealth in the IPAs. And I'm just so thrilled that we have a breadth of organizations from across the state joining us today. So please share with each other, follow the instructions Jose gave earlier, unmuting and chatting. Next slide, please. So this next poll relates to the potential business impact of the crisis on your organizations. I'll pause as you complete it.
please remember to always click submit when you have picked your answer. Couple more seconds. Okay, we're going to share the results.
Excellent. So we had about half of the respondents saying they're somewhat worried, and about another 40% saying they're very to extremely worried, which reflects the conversations we've been having with providers across the state as well, and nationally. Clearly, one way to help mitigate some of the financial impact of this crisis, especially related to the marked reduction in face-to-face visits, especially in the fee-for-service world, is through telehealth. And so that's the focus of this topic today, obviously. Next slide, please. Thank you, Jose. As you all know, the state and federal policies and directives have been changing very rapidly in this space, and we're providing links here to several key resources. We also have several links on the CQC website, which you can visit. At a high level, CMS has given guidance that care typically rendered in a face-to-face setting can, during this crisis, be rendered via telehealth with equivalent reimbursement. And the state has provided similar guidance both from the Department of Managed Healthcare and Department of Insurance most recently this week. Health and Human Services also provided guidance related to the enforcement of HIPAA during this crisis to enable use of platforms typically not used for telehealth purposes like FaceTime and Skype. We've heard from many stakeholders across the state that one, CMS has not been perfectly clear regarding the impact of telehealth visits on risk adjustment, and we're going to do our best to seek more clarification on that. And we've also heard that administrators of self-insured employer plans may not be extending these guidelines to those patients covered by those plans, and instead may be directing patients to telehealth point solutions. And we're certainly going to be advocating for changes there. Please chat in how you have been trying to stay on top of this information, what resources you found to be helpful, and how you've been, very importantly, distributing this information to the individual frontline providers to help inform them in their practice. And while you're doing that, let's move to the next slide, Jose. We'll do our next poll as well. So, Jose, could you post a poll? This question is going to be, how is the information received from your health plans? Is it very clear, somewhat clear, confusing, very confusing? And would be helpful too is if you have seen some examples of what you'd say are best in class communications from plans or other sources, please share those with the group.
Can everyone see the poll right now? Yeah. There you go. A couple more seconds for the poll.
I see one comment regarding emailing the PCPs, and I know some challenges for IPAs are having email addresses for all the PCPs or their offices. In some of my conversations, I've heard that blast faxing is working and that some other modalities may be in place, but that telephonic outreach as well has been used. Any other comments would be helpful in this regard. And thanks for the poll results, Jose. So it looks about half the people say the information from the plans is somewhat clear, and then a mix between very clear to confusing on either end. That's what we've been hearing from the groups as well. Okay, I'm going to pass it off now to Christina, who's going to carry us forward with more polling and dialogue. Thank you.
Great. Thanks, Chris. So my name is Kristen Amodi. I am Senior Manager of Improvement Advising at CQC. I joined less than a month ago. I'm going to now segue into the peer sharing portion of the webinar. And I want to encourage you to unmute yourselves either from the phone or the computer. So we're going to be talking about telehealth implementation and some of the barriers. But before we do, I wanted to share some information that we collected in the course of planning this webinar. So when you registered, you answered 2 questions. One was about how you're doing telehealth. And what we did is we analyzed the data that many of you inputted. And from about 30 IPAs and MSO organization responses, we saw a clear majority that you are all doing telehealth. Now, a couple caveats about this analysis is that the question that we asked was very broad. Are you doing telehealth? Included answers about doing care management, to doing to providers doing, you know, visits. So I think that there's obviously some more nuance that we can get to in future webinars. But I think from my perspective, I was really pleasantly surprised to see that there was on-the-ground action happening already. And that translates to some experience and hopefully good questions and peer sharing that can happen today's webinar and in future webinars. So let's go ahead to the next slide. Now, I'd like to open it up and hear what has been your IPA experience using telehealth. We're looking for some success stories and best practices. And I'm going to head and stop and see if anyone would like to kick us off in sharing their perspective and experience.
Just a reminder that if you have joined through your computer, you can just click the microphone icon in the bottom of the toolbar. And then if you join through your phone, just simply press *6 and you will mute yourself.
Hi, this is Christopher McGlone. Can you hear me?
Yes.
We can. Thanks, Christopher.
Great. So from Sharp Community Medical Group in San Diego, we have found that most of our physicians have on their own and of their own accord gone out and implemented telehealth solutions. I've seen them, whether it's Skype, Zoom, a lot of them on DoxyMe, and they've been incorporating this into their practices. So I would say probably 90% of our practices have done something along those lines. We are now cataloging that and having it identified for which physicians, primary specialty, ancillary even, and what systems they're using. So we've been very pleasantly surprised and pleased by what we've seen. It is not a coordinated system through the IPA, but each physician is able to manage it for their own practice.
And has that uptake all happened within the last 3 to 4 weeks?
Yes.
That's very impressive. Thank you, Christopher. Would another organization like to talk about their approach or what's happened for their providers in the last 3 to 4 weeks? Oh, we had a good question from the chat, and I would like to call it out from Lance Lang. Can we talk about telehealth definition? Are you including phone and secure messaging? We were focusing on phone and video visits, but if you would like, if it's useful to include secure messaging in our conversations and your experience, just let's talk about it, but please call that out. Okay, and I see Christopher, our last speaker, shared that his provider organizations are doing video and phone, and secure messaging is an option that most of our docs already use. So I'd like to go ahead and call on someone, if you don't mind. Is Cheryl Marks on the phone? I understand that Apple Care is doing some of the is offering out a free option, and we'd love to hear a little bit more about that initiative. Cheryl? Sorry, if you are speaking, you're still on mute. Reminder to hit *6 or the unmute button on your computer. Okay, we have a chat in from Nicole. I am using mostly phone with my chart pictures, not confident with setting up video access yet. Nicole, would you mind describing a little bit about your organization and when you started using MyChart?
Sure. Can you hear me?
We can. Thank you.
Oh, nice. I'm with Beaver Medical Group in Southern California. And over the past couple of weeks, we've been using telemedicine a lot. However, there's no unified approach as to which video medium to use yet. So some doctors, like the man from San Diego said, are independently using DoxyMe. That's the one I've heard of most. But I just don't think there's a lot of confidence as to which video medium to use, what is secure, what is acceptable. So we're using phone and pictures for things like rashes, and just bringing in specific patients for select sick visits if needed, if that's not adequate. That's kind of my experience so far. And the other issue is, if you just use the phone without using a visual picture, is that still considered billable if you just talk to someone on the phone and don't have that video two-way communication?
That's a good question. I'm not sure if, Chris, do we have that answer handy?
Yeah, from CMS, as well as notification that came out on the 31st of March, this past week, from the Department of Insurance in California, telephonic should be reimbursed same as audio video for those types of visits for care that could be rendered in person, but is being rendered virtually now. You're going to need, of course, the same supporting documentation that you would do for in person, but the directives there are that it should be.
Oh, good to hear. Thank you.
And then related question about communicating which platform to use and everything. What I've heard from some other groups too is just getting communication about office operations out to providers can be challenging, about which patients to bring into the clinic, about screening people telephonically before coming in for potential symptoms and temperature checks. Have the IPAs, have you been doing that centrally, or how have you been distributing that type of information out to the practices?
This is Nicole again. I can just share what we're doing.
Sure.
With our IPA here in Southern California, is that every location has screening by phone when patients call in. Also at the door, they get screened with specific questions and their temperatures checked before they're even allowed in, if they are allowed in. Otherwise, we go out to the parking lot to see some people. Our institution has set up 2 respiratory triage clinics that patients get a scheduled appointment with, so to decrease the load on each of our subsequent satellite clinics. So we're trying to do that. Yeah, and I see the comment, most of the practices implement their own screening process, same as us, mostly by phone prior to coming in, same as us, yeah.
And I see the comment about whether telephonic visits will continue once the COVID crisis wears down. And we do have a question near the end of the webinar on that topic. And yes, it's unclear what will happen in the future. We'll touch on that a little later. Thank you.
So we wanted to do a couple other pulse checks here just through the chat. how many organizations have were leveraging existing telehealth structures, and how many have launched them, or their provider organizations have launched them wholeheartedly in the last 3 to 4 weeks? Would love to just hear you via chat. Existing or launched 3 weeks ago, 4 weeks ago. And if anyone wants to speak to it over the phone, we welcome that too.
This is Jessica Voigt with Desert Oasis. Can you hear me?
Yes, Jessica, thanks. Go ahead.
Sure, certainly. We are Desert Oasis here in Southern California as well, fairly close to Beaver Medical Group as well. We've kind of implemented the same thing. Actually, within the last week, we have now implemented our virtual visits through the use of LifeSize, so another virtual visit avenue. We are very new to the process. Like I said, within the first week, that we have launched it. We too are also screening all employees as well as all patients that are entering onto our campuses to ensure for symptoms. And then we have also set up a surge type tent for our locations as well, essentially like a respiratory clinic to send anybody with respiratory or fever type symptoms to be screened for those sort of things. So that's kind of what we have kind of done. We are also encouraging our PCP providers as well as our specialists to utilize telephonic visits as well, but we are trying to flip as many of those telephonic visits to virtual visits as possible as we start to continue down the road. One portion where we're kind of running into who we bring in and who we don't is with regards to our infusion clinics and also our wound care clinics, where some of these patients are requiring treatment that we would typically do in the outpatient setting. So that's one of our current barriers that we're working on right now.
Thanks, Jessica. And just a follow-up question on that. So you're transitioning phone visits into virtual, meaning video, or was there another another modality there?
Correct. Meaning trying to capture as many as we can through the video process versus telephonically. So we're actually kind of using a 3-tiered system. Plan A would be that we utilized virtual video through LifeSize. Plan B would be if that didn't work, that we would try and utilize FaceTime or Skype, Zoom, one of those other options. And then Plan C would be telephonic.
Great, that's really helpful. I wanted to just go to the chat and see what other organizations had responded to this question. We had Chris, the previous speaker, who said that they've launched in the last 3 to 4 weeks. Rosemary Den Whedon was saying that they are using existing and expanding on that. Another vote for very minimal the last 3 to 4 weeks. Another 3 to 4 weeks. So looks like most providers have been launching really recently. I just wanted to call out a couple of resources that have also popped up in the chat. Chris linked to the Department of Insurance, I believe, guidance, and then Jody from CMA directed us to the CMA website on COVID-19, and we'll make sure to put these on the CQC resource page as well. So the next question that we wanted to segue to was learning more about which percentage of visits that are being done by telephone and which percentage are by video. And I know that this would be kind of a hard thing to pin down at this current juncture, but if you can give us just ballpark, majority telephone, majority video, perhaps like Jessica, you're trying to transition one into the other, but if you could chat that in, or as always, feel free to speak up right now too. So we saw one chat from Chris, vast majority by video. Mostly phone right now, but want to move more to video. So that's similar to Jessica. Majority by video. Okay. And then the last question is, what platforms and vendors are currently being used on the provider side or or the IPA side. We have a couple of examples here, but I think that we heard others mention in the course of the call. So if you wouldn't mind chatting in, is it Amwell? Is it video? Is it secure video? Skype, FaceTime, Zoom, MyChart? Feel free to chat in, and we would love to, if you have a great experience with a particular platform or vendor, please speak up and share right now.
And please remember that to mute yourself, if you have joined through a computer, just click the microphone icon in the toolbar in the bottom. Or if you have dialed by phone, just press *6.
Christina, this is April from CQC. I just wanted to pipe up here to say, everything's happening so fast. I was on a call yesterday afternoon, so I haven't had a chance to confirm this yet, but someone was sharing that Zoom was actually offering free licenses for frontline providers, for those offering patient care. So again, I haven't had a chance to confirm that, but I did hear that, just in case anyone's hearing about the use of that platform.
That's great. Thank you, April. Okay, so just peeking into the chat, what we see are Zoom, Skype, FaceTime, DoxyMe, Skype, Viva Engage, LifeSize, DoxyMe, and a vote that the physicians really like Doxy, and it's $30 a month. LifeSize for video and Well for texting. EHR platforms that include MyChart and ECW. So would anyone like to speak to or call out their provider's experience with a particular platform or vendor? Okay. Well, we're going to go on to the next portion of our peer sharing, and now is when we're going to talk about barriers and challenges. So if you wouldn't mind going to the next slide, Jose, I'd love to open it up now. So what do you perceive as your biggest barrier to launching or expanding telehealth? So Jessica texted an older patient demographic, homeless members without phones, patient acceptance, Teresa, if you're able to unmute, can I ask you to expand a little bit about the patient acceptance and where you perceive the barriers to be there?
What I've heard from our team is that a lot of times patients still want to come in. Mm-hmm. They want to come in and see their provider. And a lot of our physicians are older and they're at risk as well for COVID. So we're trying to limit their appointments that are face-to-face. And so we're trying to message to them that this is really in their best safety and their health team's best safety. And that a lot of these visits can be done with the video over the phone. Mm-hmm. What's interesting is a lot of the patients will say they just want to do a telephonic visit then. They don't want to deal with the video part. So we're trying to get, and also our team, we're just started doing that this week, really integrating the video. Mm-hmm. But I think as you do it more often, it's going to get easier and the patients will get more used to it as well. So as it's kind of new, those are the feedback we've gotten the last couple of days, but I'm hopeful that it's going to get more smooth and the patients will accept it more over time. So in a way, we have to seize this moment where people kind of there's a really compelling reason to convert to the video visit, but there is definitely a patient acceptance factor.
Right. Does anyone have any resources or guidance for educating patients on why virtual visits are the way to go right now?
I'm curious as well on the provider acceptance front as well. Can anyone comment on what the provider experience has been, positive or negative, with respect to using video versus telephonic?
Yeah, this is Christopher from Sharp Community. The physician acceptance has been pretty amazing. I met with a group of 10 physicians last night, and they're all excited about what this means going into the future. They've said many of them will adopt this as part of their practice, their standard practice model as they move forward, whereas these physicians were not even remotely interested in doing it before the crisis hit. So I think it's really going to be a big benefit. Now, you know, that all will be impacted obviously by what the payers do in terms of compensation, but I think they really like it. They say that their patients enjoy it. Even the elderly population who is now more used to interacting with their grandchildren via FaceTime and other, you know, video kind of interactions. So they're very pleased with it.
Chris, can I ask you to build on that just a little bit? Have you seen a similar reaction across the whole care team? Are other staff just as enthusiastic?
I think, you know, our staff who've been using, we've been using these vehicles through InTouch. That's our system approach, is InTouch telehealth. And we've been using that with a social worker and others with some behavioral health things. They've been very pleased with how that's been used. So I think both employees, and now we're looking at expanding that out with our pharmacy team. As patients are being home, how can we engage with the chronically ill who may not be going in any longer but need still help and assistance? So we're looking at that with our case management team and our pharmacy team to help out there.
Fantastic, thanks, Chris.
Yeah. I'm sorry, I don't know if I have the name correct, but there's a comment in the chat from Jay Orell. Physicians are also very accepting, and most clinics are actually reaching out to more members compared to before. I'd love to hear a little bit more about how that outreach has actually increased.
Awesome. Oh, can you hear me now?
Yes.
Okay. So yes, so we for the transition of care team, I'm calling from MedPoint Management. So we have a few IPAs that we manage in Southern California. So the responses that we got because of the whole COVID thing, some members don't want to go to the clinics, right? But because of this telehealth option, they prefer it, and they've seen more people. Because like some clinics that have like lengthy or long appointment visit times are now being accommodated quicker. So that helped in that sense. So there's an increase in, like, you could say, show up rate, but it was more on, you know, they're going to hold up people who have, you know, capability to do telehealth. The only problem we're experiencing is the homeless population with no phones and no access to videos or phones at all. You know, so that's the problem we're having. Like after they get discharged from the hospital, now what? You know, how are they going to get seen? You know, because what we're trying to do right now is we're reaching out to them while they're at bedside. So before this whole COVID fiasco or the pandemic happened, we were giving them appointment dates and times and pickup times at this corner or shelter that they're at, and then you just show up, they get picked up, go to the clinic. But since, especially if they're being ruled out for COVID, of course some of the clinics are not even seeing them at all, like face to face. So that's the barrier we're having right now.
So it sounds like you're actually continuing chronic care management over telehealth.
Correct. So with chronic care management and also the acute one.
That's great. Thank you. So we'd love to then hear, and in chat or otherwise, what what have been really impactful resources as your providers are taking on these new workflows in a very short period of time? What have been really great examples of, or either products or tools, resources, links? Let's collect them right now and hear what's been most impactful for you and the organizations you're working with. And I would say too, if you're not an IPA and you're tuning in and you have a resource you'd love to share, this is the time to bring it up, because on our last webinar, which we hosted 2 weeks ago, we had a great offering of support from all different realms. So I would say if you have other resources that you think would benefit the IPA audience, please chat them in or, speak up too. Okay, so I hear a vote for documentation, in that it's taking longer to do a video visit and having to have their visit over smartphone as they're using their laptop to chart. So there's definitely some inefficiencies in documentation workflow.
Hi, this is Sarah from CMA, and I just wanted to point back to the website that Jody pointed to, but we have a webinar on how to implement telehealth in your practice and has some kind of good advice on what to do to actually make it easier, and we're working on a telehealth guide. We also have a partnership with Amwell, which has a private practice option, as well as their medical group for overflow and extra, if you have extra bandwidth or capacity. So I would encourage you to kind of look at that site, as well as we are taking advice for learning more about what physicians need to implement, and also have some good guidance if it's helpful.
Thank you so much, Sarah. We'll make sure to point folks to that.
Related to the comment of using their smartphones to do the visits, if they're doing, it sounds like most are shifting to video versus telephonic, but for telephonic, are they using personal smartphones or are they using work smartphones? And I ask in part because we noted a resource on our webpage. Doximity has been offering free use of an app that allows the caller ID of a patient's phone to show up like it's being called from the physician's office versus their personal smartphone.
I think there was a question of what was the app, Chris?
Yeah, I don't remember the name offhand. I'll look it up on the website and post it in the chat in a second here.
Okay, thank you. Well, we'd like to segue then to another poll, which is asking, and next slide, Jose, if you don't mind, which is asking about what are the top 3 resources or support that you would find most useful in launching or spreading telehealth. And we have platform or vendor, documentation guidance, billing support, care team workflows, privacy and policy guidelines, and financial support for actually startup costs or maintenance. If you have another vote, feel free to chat that in, but we're going to go ahead and pause for a few seconds while we get this vote. And I think this is something I would say the resources could be something that CQC could provide, or another that could be provided in another venue, because we are definitely sharing this information with our other stakeholders.
Please make sure to click the button submit for the answer to be recorded.
So Chris, do you want to mention the link that you posted in the chat?
Sure, that's the link to the Doximity website, which does an overview of the free support they're giving, including the app.
Okay, and thank you, Sarah, for linking to the CMA Amwell site. Okay, let's go ahead. Maybe give 5 more seconds for the poll, Jose.
Yep. You'll see a couple of answers. Make sure you submit your answer. Okay.
Okay, I think we have a close tie, a close race, but Billy Guidance came out first, closely followed by Care Team Workflows. But there were additional questions about documentation guidance. So thank you very much. We didn't see, I don't think we had any other chat requests, but if there's something that's not on this list, do chat it in either in the broad chat, or you can feel free to chat it to a CQC staff person. While we're thinking about telehealth, we also wanted to understand how telehealth is being approached kind of from a strategic long-term angle. So I know it's difficult right now to think of anything beyond day-to-day or week by week, but we'd love to segue to the next slide and poll and understand how you're thinking about telehealth. So we're asking you to describe how you would respond to the statement. Beyond this crisis, I expect practices in my organization to use telehealth more or differently than they had before. So do you strongly agree, you're neutral, disagree, or strongly disagree? So let's go ahead and launch that poll. Oh, looks like we're already getting some folks eager to chime in over the chat. A couple of strongly agrees. Thanks, Jessica and Michelle. And while folks are taking the poll, Jody, thank you for letting us know DMHC is working on a draft all plan letter that will require plans regulated by DMHC to accept claims coded in a specific way, meaning with modifiers and a place of service to use. Jody, can I ask you to describe that, or what your understanding about the timing of that, or anything else you'd like to add?
I know they are trying to get feedback by end of day today, so I would imagine it would be rolled out fairly quickly after that. And that is based on a call that DMHC, DHCS, a number of health plans and some of the associations participated in last week. It sounded like there was a huge interest in having what was referred to as kind of a single source of truth on how the claims should be submitted based on their prior APL.
Okay. That's super. Thank you for that update. So we had 67 votes, and overwhelming strongly agree or agree that telehealth is going to be the future. So Chris, anything that you'd like to speak to for what these results say to you?
It reflects what I've been hearing from the groups as well, that this crisis is perhaps providing us an opportunity to change how we deliver care. Certainly the rapid onboarding of providers in an unprecedented way, implementing telehealth essentially with no project plans, just doing it, caring for the patients in whatever way they can, and having patients jump on board as well and experience it. And I'd like to comment earlier about that elder patients do interact with their families virtually. And so the hurdle isn't necessarily as big as we might assume it would be. So great to hear that that's the general sentiment now. And I'd like to continue the conversation with you and advocate for you for that as we move forward.
Thank you. Also just wanted to call out from the chat, would value discussion in the future of how other team members besides the doctor are using these tools. So nurse practitioners, nurses, and medical assistants. And yeah, I would agree. I think how the care team is setting up workflows and optimizing and feeling confident in using these tools would be definitely valuable to go deeper on. So on to the next slide. We wanted to hear from you that tuned in on this webinar. What cadence would make sense to bring us all together. Obviously, we've said this many times that things are moving very quickly. So, you know, I think that there's definitely some value in getting together on a weekly basis, but and Jose, if you wouldn't mind running that poll right now. But if we did get together at a weekly basis, I think it would be more of a peer sharing and kind of casual, informal session. But if we did it bi-weekly, I think there would be an opportunity to find dedicated speakers and maybe some subject matter experts to speak to some of the issues that have been raised. At the same time, while we've been thinking about it, I know that I've personally heard some really great ideas about future webinar topics that would be a closer look at implementation issues, billing issues, covering those in greater detail. But if you do have ideas specifically about webinar topics, please chat them in. We will look at these and use them to plan future sessions. Okay, see a couple votes for mostly bi-weekly, but there is a comment in the chat, but sharing only new information, discuss or understand. There's a lot of information flowing and it's hard to know what has value. Yeah, that's definitely true, and we'll make sure to take that in mind when we're scheduling. All right, I think that's it for our content. We're just going to segue into our closing. So the next webinar topic that we have scheduled is the implementing telehealth, supporting telehealth for small practices. So we don't have a date or time for this yet, but you all are on the list now, so you'll receive information when we do. And we encourage you to take a look at our COVID-19 website, look to the HealthNet RFS that we mentioned earlier in the webinar, and the CQC team is available for support if you're considering putting in an application. And if you have any other questions, please reach out to us.
Yeah, hi, this is Bart Wall from CQC. Hello, can you hear me?
Yes, thanks, Bart.
Great job, everybody, by the way. Thanks for putting this together on the fly. I did have a question, and maybe we could poll people at the next meeting, which is, does the provider's choice of a telehealth system affect the patient's experience? And if so, is there a way for us to gather information on which systems seem to be preferred or be used more easily by the themselves that would be useful in making long-term decisions about telehealth systems?
That's a good reminder. Thanks. Okay, thank you very much for joining us during a very busy time, and look for an email from the CQC team with this webinar deck and recording and the resources mentioned, and stay tuned for a future webinar. Take care all.
Thank you.
Thank you.